Hello friends, I am Dr. Varsha Kashav, Professor Swami Vivekanand Institute of Pharmaceutical Sciences, SVN University, Sagar. Today in this session we will learn the urinary antiseptic. That script is divided into 7 different modules. Module 1 Introduction, Module 2 Urinary Antiseptic, Module 3 Quinolones, Module 4 Nalidixic acid, Module 5 Nitrofurantion, Module 6 Disinfectant and Antiseptic, and Module 7 is Conclusion. Let's start with Module 1 is Introduction. Urinary tract infection UTI is defined as the presence of microbial pathogens in the urinary tract with associated symptoms. The urinary system consists of the kidney, ureters, bladder and urethra. These infections account for about 8.3 million cases each year. Depending upon the part that is infected, UTI are classified as: first, cystitis, that is infection in the bladder; pyelonephritis, infection of one or both kidney; urethritis, infection of the urethra tube that empties urine from the bladder to the outside. Urinary tract infection is the second most common type of infection in the body. Owing to the female anatomy, women are more commonly affected by UTI than men. Shorter urethra and proximity of the urethra opening to the anus and vagina, sources of bacteria, make women more prone to UTI. UTI are caused by microbes including fungi, viruses and bacteria. The most common causes of UTI is bacteria from the bowel that lives on the skin near the rectum or in the vagina, which can spread and enter the urinary tract. Usually bacteria enter the urethra and then the bladder, causing an infection, most commonly in the bladder itself, which can spread to the kidney. Symptoms of urinary tract infection include painful and frequent urination, fever and flank pain. UTI are caused by microbes including fungi, viruses and bacteria. However, bacteria E. coli are the most common cause of UTI. Now, symptoms of urinary tract infection. The most commonly occurring symptoms are strong persistent urge to urinate, frequent urination, painful burning feeling in the urethra during urination. Often women feel an uncomfortable pressure above the pubic bone, and some men experience fullness in the rectum. Acute pyelonephritis, flank pain, high fever, several chills, night sweating and nausea or vomiting. Cystitis, pressure in the lower abdomen and strong smelling urine. Urethritis, pus in the urine. In men, urethritis may cause penile discharge. The diagnosis of urinary tract infection are urinalysis to look for the presence of bacteria and pus cell in the urine can be helpful in diagnosis UTI. An ultrasound examination, CT scan, MRI of the kidney and bladder may be necessary in some patients to reveal urinary abnormalities and measure how well the kidney work. A dipstick test is also available and it can give diagnosis within a short period. Voiding cystoethiogram is another test that may be performed. It involves installing a chemical into the bladder and taking serial X-ray as the patient urinates. This test is usually undertaken if the UTI keeps occurring repeatedly in children. If the above tests are positive, a urine culture can reveal the infection and type of bacteria causing the infection. Module 2 Urinary Antiseptic. An antiseptic is a chemical compound that kill or inhibit the growth of microorganisms. When applied to a living tissue like skin, etc., urinary antiseptic are those chemical agents that used for treatment of urinary tract infection. They are concentrated in the kidney tubules and are useful mainly in lower urinary tract infection. They have been called urinary antiseptic because this may be considered as a form of local therapy Nitrofurantoin and methenamine are two such agents. Infrequently used now, nalidixic acid can also be considered to be urinary antiseptic. A. Methenamine. Synthesis and properties. Activity of hexamethylene tetramine depend on the liberation of formaldehyde. The compound is prepared by evaporating a solution of formaldehyde and strong ammonia, water to dryness. The free base exists as on odorless, white crystalline powder that sublimes at about 260 degrees centigrade. It dissolves in water to form an alkaline solution and liberate formaldehyde. When warmed with mineral acid, methenamine is a weak base with a pK of 4.9. Methenamine is used internally as a urinary antiseptic for the treatment of chronic urinary tract infection. The free base has practically no bacteriostatic power. Formaldehyde release at the lower pH of the kidney is required. To optimize the antibacterial effect, an acidifying agent such as sodium biphosphate or ammonium chloride generally accompanies the administration of methenamine. Certain bacteria strains are resistant to the action of methenamine because they elaborate urease, an enzyme that hydrolyzes urea to form ammonia. The resultant high urinary pH prevent the activation of methenamine, rendering it ineffective. This problem can be overcome by the co-administration of the urease inhibitor, acetohydroxamic acid. Mechanism of action. It is hexamethylene tetramine, inactive as such, decompose slowly in acidic urine to release formaldehyde, which inhibit all bacteria. This drug exerts no antimicrobial activity in blood and tissues, including kidney, parenchyma. Acidic urine is essential for its action. It must decompose at an acidic pH of 5.5 or less in the urine, thus producing formaldehyde. Antibacterial spectrum. A. Primarily used for chronic suppressive therapy. B. Urea splitting. Bacteria that alkalinize the urine are usually resistant to the action of methenamine. Now, adverse effect. At higher dose, albuminuria, hematuria and rashes may be developed. Methenamine mandylate is contraindicated in treating patient with renal insufficiency because mandelic acid may precipitate sulfonamide react with formaldehyde. Now, module 3, quinolones. Quinolones, these are synthetic antimicrobial having a quinolone structure that are active primarily against gram-negative bacteria. Through newer fluorinated compounds also inhibit gram-positive one. The first membrane nalidixic acid introduced in mid-1960s had usefulness limited to urinary and GIT infections because of lower potency, modest blood and tissue level, limited spectrum and higher frequency of bacterial resistance. A breakthrough was achieved in the early 1980s by fluorination of the quinolone structure at position 6 and introduction of a piperazine substitution at position 7, resulting in derivative called fluoroquinolones with high potency, expanded spectrum, slow development of resistance, better tissue penetration and good tolerability. Now, classification of quinolones. Antibiotic. Research divided into quinolones into generations based on their antibacterial spectrum. The earlier generation agents are, in general, more narrow spectrum than the later one. The first generation is rarely used today. Nalidixic acid was added to the OEHHA Prop 65 list as carcinogen on 15 May 1998. The drug most frequently prescribed today consists of Avelox, Cipro and Levaquin. Now, first generation drugs like sinoxacin, nalidixic acid, oxolinic acid, pyrimidic acid, pyrimidic acid, rosoxazine, and the second generation drugs are ciprofloxacin, enoxacin, fluroxacin, lomefloxacin, nadifloxacin, norfloxacin, ofloxacin, pefloxacin, rofloxacin, etc. Third generation drug, unlike the first and second generation, the third generation is active against streptococci like belofloxacin, gripifloxacin, levofloxacin, pezofloxacin, sparfloxacin, temafloxacin, tosufloxacin, and the fourth generation drug fluoroquinolone act as DNA gyrase and topoisomerase. This dual action slow development of resistance. For example, clinafloxacin, getifloxacin, gemifloxacin, moxifloxacin, sitafloxacin, trovafloxacin, prulifloxacin, etc. Now, these are the structure of quinolones. The two common characteristics for first generation quinolones are A. Narrow antibacterial spectrum designed specifically for Enterobacteriaceae. Second, a pharmacokinetic which allow for rapid elimination and reduced tissue absorption, only allowing them to be used as urinary antiseptic. Now, these are the figures of first generation quinolones, second generation quinolones, third generation quinolones, and fourth generation quinolones. Now, coming the mechanism of action, first and second generation quinolones and fluoroquinolones selectively inhibit the topoisomerase ligase domain, leaving the 2-nucleus domain intact. This modification, coupled with the constant action of topoisomerase second in the bacterial cell, lead to DNA fragmentation via the nuclease activity of the intact enzyme domain. Third and fourth generation fluoroquinolones are more selective for the topoisomerase 4 ligase domain and thus have enhanced gram-positive coverage. For many gram-negative bacteria, DNA gyrase is the target, whereas topoisomerase 4 is the target for many gram-positive bacteria. Some compounds in this class have been shown to inhibit the synthesis of mitochondrial DNA. Now, module 4, Nalidixic acid. Nalidixic acid, that is 1-ethyl-1,4-dihydro-7-methyl-4-oxo-1,8-naphthyridine 3-carboxylic acid. Nalidixic acid is useful in the treatment of urinary tract infection in which gram-negative bacteria predominate. The activity against indole-positive Proteus species is particularly noteworthy, and nalidixic acid and its congeners represent important alternatives for the treatment of urinary tract infection caused by a strain of these bacteria resistance to other agent. The 7-hydroxymethyl metabolites is significantly more active than the parent compound. Mechanism of action: intracellular, they uniquely inhibit the replication of bacterial DNA by interfering with the action of DNA gyrase during bacterial growth and reproduction. It is active against gram-negative bacteria, specifically coliforms E. coli, Proteus, Klebsiella, Enterobacter, Shigella, but not Pseudomonas. It acts by inhibiting bacterial DNA gyrase and its bactericidal. Now, module 5, Nitrofurantoin. Nitrofurans, the first nitro-heterocyclic compound to be introduced into chemotherapy, were the nitrofurands. Three of these compounds, nitrofurazone, furazolidone and nitrofurantoin, have been used for the treatment of bacterial infections. The nitrofuran are derivative of 5-nitro-2-furaldehyde form on reaction with the appropriate hydrogen or amine derivative. Antimicrobial activity is present only when the nitro group is in the 5th position. It is mutagenic and carcinogenic under certain conditions. It is through the DNA damage caused by metabolic reaction product may be involved in these cellular effects. Nitrofurantoin, 1,5-nitro-2-furfuryldene, 1-aminohydantoin is a nitrofuran derivative that is suitable for oral use. It is recommended for the treatment of urinary tract infection caused by susceptible strain of E. coli, Enterococci, as aureus, Klebsiella, Enterobacter and Proteus supplement. The most common side effects are gastrointestinal like anorexia, nausea and vomiting. However, hypersensitivity reactions, pneumonitis, rashes, hepatitis and hemolytic anemia have occasionally been observed. A microcrystalline form is claimed to improve gastrointestinal tolerance without interfering with oral absorption. Now, mechanism of action. It is primarily bacteriostatic but may be cidal at higher concentration, and in acidic urine its activity is enhanced at lower pH. It inhibits many gram-negative bacteria, but due to development of resistance, activity is now restricted largely to E. coli. Resistance to nitrofurantoin develops slowly and no cross resistance with any other drug. It antagonizes the bactericidal action of nalidixic acid. Susceptible bacteria appear to enzymatically reduce nitrofurantoin to generate reactive intermediate which damage DNA. Sensitive bacteria reduce the drug to an active agent that inhibit various enzymes and damage DNA. Antimicrobial spectrum, bacteriostatic, useful against E. coli, gram-positive cocci are susceptible resistance associated with an inability to reduce the nitrogen group in the presence of oxygen. Pharmacokinetics. Absorption is complete after oral administration, rapidly excreted by glomerular filtration. Their adverse effect is gastrointestinal disturbance, nausea, vomiting and diarrhea. Second, acute pneumonitis are serious complications, neurological problem, headache, nystagmus and polyneuropathies with demyelination. Then, hemolytic anemia, contraindicated in patient with glucose 6-phosphate, dehydrogenase deficiency, neonate and pregnant women. Urinary analgesic, pain and discomfort frequently accompany bacteria infections of the urinary tract. For this reason, certain analgesic agents such as the salicylate or phenazopyridine, which concentrate in the urine because of their solubility property, are combined with a urinary anti-infective agent. Phenazopyridine hydrochloride, 2,6-diamine 3-phenylazopyridine hydrochloride. Pyridium is a brick red fine crystal powder. It is slightly soluble in alcohol, in chloroform and in water. Phenazopyridine hydrochloride was formerly used as a urinary antiseptic, although it is active in vitro against staphylococci, streptococci, gonococci and E. coli. It has no useful antibacterial activity in the urine. Thus, its present utility lies in its local anesthetic effect on the mucosa of the urinary tract. Usually, phenazopyridine is given in combination with urinary antiseptic. For example, it is available as azogastrin, a fixed dose combination with the sulfonamide antibacterial sulfoxazole, and as urobiotic, a combination with the antibiotic oxytetracycline and the sulfonamide sulfamethoxazole, etc. The drug is rapidly excreted in the urine, to which it gives an orange-red color. Stain in fabrics may be removed by soaking in a 0.25% solution of sodium dithionate. Module 6, disinfectant and antiseptic. Anti-infective agent or germicide or biocides may be broadly classified as antiseptic and disinfectant. They are used to kill or restrict the growth of microorganisms when applied to the living tissues or inanimate objects. An antiseptic is a chemical compound that kill or inhibit the growth of microorganisms when applied to a living tissues like skin, etc. While a disinfectant is a chemical compound that prevent infection by the destruction of harmful microorganisms when applied to inert object like forceps, bedding, floor, etc. They should possess the following properties like chemical stability, economical, non-staining, with acceptable color and odor, bactericidal, not only static but capable of destroying spores as well, then wider spectrum of action. An antiseptic in addition should be rapid in action and exert sustained lethal action, then non-irritating to tissue when applied, then non-allergic to the subject, no systemic toxicity, then active even in the presence of body fluid, for example blood, pus. A disinfectant in addition should be like non-corrosive, good penetrating agent, then compatible with other organic compound like soap. A wide variety of active chemical agents are found in these products, many of which have been used for hundreds of years for antisepsis, disinfection and preservation. Despite this, less is known about the mode of action of these active agents than about antibiotics in general. Biocides have a broader spectrum of activity than antibiotics, and while antibiotics tend to have a specific intracellular target, biocides may have multiple targets. The widespread use of antiseptic and disinfectant product has prompted some speculation on the development of microbial resistance, in particular cross resistance to antibiotic. A summary of the various antiseptic and disinfectant with their chemical structure and clinical use is shown in given table. In this table, they have different classes, their name, their structure and their uses. Like the first one is alcohol, for example ethanol and isopropanol, and their use is antisepsis, disinfection and preservation. Then second class is aldehyde, for example glutaraldehyde and formaldehyde, and their use in disinfection, preservation and sterilization. Next class is anylides, for example trichlocarbon, and their use in antisepsis. The next one class is phenols, for example phenol, thymol, cresols of different position, orthoparameta, resorcinol and chloroxylenol, and their use in antisepsis, disinfection and preservation. The next one class is bisphenol, for example triclosan, and their use in antisepsis, anti-plague, deodorant and preservation. The next one class is biguanides, for example chlorhexidine, and their use in antisepsis, anti-plague, disinfection and preservation. Next one class amidine, for example propamidine, and their use in antisepsis and preservation. Next one class halogen releasing agent, for example chlorine compound and iodine compound and bromine compound, and all these use in antisepsis, disinfection and cleansing. The next one class is heavy metal, for example mercury compound, and their use in antisepsis, preservation and disinfection. The next one class is peroxygen, for example hydrogen peroxide, ozone, peracetic acid, and these are used in disinfection and sterilization. The next one class is quaternary ammonium compound, for example citramide, and benzalkonium chloride, and they are used in antisepsis, preservation, disinfection and cleansing. Then next one class is dyes. For example, triphenyl methane dyes, and they are used in disinfection. Some other example is also there of dyes like thiazine dyes, acridine dyes, xanthine dyes. All these are used in disinfection. The next one class is acid like boric acid and acetic acid, and they are used in the preservation. The next one class is furan derivative, for example nitrofuran, and they are used in antisepsis. And the last one class is oxide, for example ethylene oxide, and they are used in sterilization and disinfections. Now the synthesis of some important antiseptic and disinfectant. First, synthesis of thymol. Thymol is prepared by acetylation of M-cresol to give M-acetoxy, toluene, which is treated with acetone, and Rene-nickel yield the resultant product. Then next, synthesis of hexachlorophane. It is prepared readily by condensation of 2,4,5 trichlorophenol with formaldehyde in the presence of sulfuric acid. Next one synthesis is synthesis of hexyl resorcinol. It is prepared by 4N-hexyl resorcinol, is achieved by a two-step process involving first is preparing hexyl resorcyl ethers by reacting resorcinol with a hexylating agent having the general formula 1C6H13X in the presence of a base, and the second treating the reaction product obtained with a catalyst to yield 4N-hexyl resorcinol by a rearrangement process. X can be selected from the group consisting of Cl, Br, I, Ar, SO3 and similar materials. Then synthesis of chlorohexidine. It can be synthesized by combining cyanoguanidine and hexamethylene diamine at room temperature, pressure and rapid stirring. Then synthesis of acryflavin. Acryflavin is synthesized by the reaction between amphenyline diamine, glycerol and oxalic acid in the presence of zinc chloride and sulfuric acid. Then synthesis of gentian violet. The reaction of N,N-dimethyl paratoluidine with N,N-dimethyl aniline in the presence of mild oxidant such as nitrobenzene and sodium chloride led directly to gentian violet. Then synthesis of methylene blue. The para-amino dimethyl aniline is oxidized in acid solution with a second molecule of dimethyl aniline, and at the same time the thiosulfonic acid group is introduced into the molecule, which is affected by carrying out the oxidation in the presence of nascent thiosulfuric acid. The thiosulfuric acid is now converted into methylene blue by closing the ring with the add of more oxidizing agent. Now coming the mechanism of action of some antiseptic and disinfectant. In this table some antiseptic, disinfectant is there, their target and mechanism of action. Like the first one, target is cell envelope, cell wall, outer membrane, and the antiseptic is glutaraldehyde, and their mechanism of action is cross-linking of proteins. Then second target, cytoplasmic membrane. Antiseptic, disinfectant are chlorohexidine, diamine, PHMB, alexidine, phenol, etc. And mechanism of action is chlorohexidine is lower concentration affect membrane integrity, high concentration cause congealing of cytoplasm. Diamine, introduction of leakage of amino acid. PHMB, alexidine, the mechanism of action is phase separation and domain formation of membrane lipid. Then phenol is leakage, some cause uncoupling. The next one, target is cross linking of macromolecule. For example, the antiseptic is formaldehyde, and their mechanism of action is cross-linking of protein, RNA and DNA. The second of same target is glutaraldehyde. Their mechanism of action is cross protein in cell envelope linking. The next one target is effect on DNA, and the antiseptic disinfectant is halogens, and their mode of action is inhibition of DNA synthesis. The second one is hydrogen peroxide, silver ion, and their mode of action is DNA strand breakage. Factor modifying the action of antiseptic and disinfectant, like the first one temperature, second pH, third is concentration of the compound, fourth is surface tension, fifth is time of contact with the microbes, next is nature and amount of microbes, and the seventh is pressure of organic matter and body fluid, eighth is nature of the compound, ninth is nature of the surface to which they are applied. Now module 7, conclusion. With all these information, here we come to end of the today lecture. Today we have discussed in detail about UTI and their treatment. Urinary tract infection is defined as the presence of microbial pathogens in the urinary tract with associated symptoms. The urinary system consists of the kidney, ureters, bladder and urethra, depending upon the part that is infected. UTI are classified as cystitis, infection in the bladder, urethritis, infection in the urethra tube that empties urine from the bladder to the outside. Owing to the female anatomy, women are more commonly affected by UTI than men. UTI are caused by microbes including fungi, viruses and bacteria. The most common causes of UTI is bacteria from the bowel that lives in the skin near the rectum or in the vagina, which can spread and enter the urinary tract. We also discussed the synthesis and mechanism of action of some important urinary antiseptic and disinfectant like quinolones, nalidixic acid, nitrofurantion, etc. Further, have a look again on the complete topic yourself so you are thorough with it. The topic that we have discussed today is very simple and interesting. So dear student, this is Dr. Varsha Kashav takes leaves from you with the hope that you have enjoyed and understood today's lecture. We will continue in our next lecture with another topic. If you want to learn more and enhance your knowledge, you may log on our website www.cec.nic.in. Till then, keep studying. Goodbye.